Good morning. So we are here for health talks, Pranad Ayurved's health talks, and today with us is Dr. Dhanya. She is from Janakimadhavam Ayurvedic Clinic, Thrissur, Kerala. So ma'am has a habit to wake up early in the morning. So my first question to madam is how important is dincharya according to Ayurveda? Namaste, madam.
Namaste, Namaste, Sahir. Very good morning. Yes, I love to get up early in the morning, though it was very difficult for me a few days back. But in our Ayurvedic Dinacharya, it's already mentioned that Brahmi Muhurte Uttishtet Swaste Rakshatam Ayushaha. So getting up early in the morning is really a very good thing, which I know by my experience. Okay. If you say about Dinacharya and the health, in Dinacharya, we already know that the first thing is getting up early in the morning. And then usually what I do is we have a small prayer after getting up early in the morning, just to start up with. That is seeing our hands, joining our hands together like this, and then seeing it and saying, Karagre Vasate Lakshmi, Karamadhe Saraswati, Karamoledu Govindo, Prabhate Karadarshanam. And then just join. So this also has a scientific meaning for that, to get up early in the morning and see your hand. And then after that, you can continue with the normal regimens. But in Ayurveda, we have separately systematic regimens, which is designed so that a healthy person can maintain a health and a disease can also cure the disease faster. Yes.
So actually, what I see in South India, I visited Tamil Nadu. I haven't visited Kerala, but I have visited Tamil Nadu. So what I have seen that those people are following certain rituals from morning till the evening. So although they are not, they don't know that they are connected to Ayurveda in some way. But what I saw and what I have read in Ayurveda texts, they are quite similar to that Ayurveda text. So can you tell me any rituals that you people follow and you connect it with the Ayurveda and it related to your health also?
Yes, here we do a lot of rituals which are connected to Ayurveda. That is not only getting up early in the morning, it is also like doing our daily routines like brushing teeth, cleaning our orifices, malamutra visarjanam, everything. After that, we do a bath. I mean, before that, we just go for a little vyayamam. Not everybody, maybe some few elders, elderly people who know about the health. And mostly I can say the men who follow this correctly. Women was always busy with the household works, but that is also a kind of vyayama, what we say in Ayurveda, that whatever we do according to our capacity, that is still we sweat. And there are some points told in Ayurvedic text that how to do a vyayama, and it should not be over and it should not be very less also. It should be up to our capacity. So like that, even the women also do in the household things. But men usually follow a little bit of walking or early yoga, pranayam, a small exercise, everything, and then start up. Then also when I see in Kerala, we take bath. Before bath, we do Abhyanga Snanam. That is really told and very mentioned in each and every text in Ayurveda.
Yes,
Abhyanga Snanam has a lot of importance, as you already know. So I think about that we can discuss later, I think, the importance of Abhyangam. But then yes, we do Abhyanga Snanam, especially the main mention, that is Pradhana Sthanam, that is Shira Shravana Padeshu, Abhyangam Acharya. That is very, very important. And that we surely do. Not the whole body might be every day, but then Shira Shravana Padeshu is sure. That is one ritual which we usually follow here.
Yes,
and then again, if you go in deep, if you say in for head, we have separate oil which we our mothers and grandmothers usually prepare in house, because the natural herbs are already present in our garden.
I have seen people don't buy oil from the market. They prepare especially for their hair. they prepare on their own
Yes, yes,
in South India. That's true.
yes, yes.
Yeah.
And that's why we have a lot of hairs here. And also we take care of hairs so much here.
Yes, in South India, true. So my next question is with the food habit. I told you I have visited Tamil Nadu. So there I have visited an ashram, and they have rituals that with food they give some kashayams. Although I know what are kashayams, in North India people don't know what are kashayams. Although they know what is kadha, but also that kadha they know what the people prepare at their home. Simple basic kadha from the herbs from the kitchen. But in South India, we know that there are n number of kashayams for different diseases. So can you explain a little about kashayams?
Yes, as you said, we use a lot of herbal decoctions here, which is known as kashayams. More than rasa medicines, we use kashayam here for treating diseases, or might be even in a healthy condition. That's because, as I said before, only the availability of drugs. Each and every home, almost every home has a garden here in Kerala. At least it might be a simple drugs that like shunti or curry leaves, drumsticks, or might be turmeric, something, or banana. Banana, I think almost every home has a banana tree here. And tulsi is very important. And there is also one aromatic drug which we use in our normal this one, that is panikurka, we say in Malayalam. I think it is known as Coleus embolicus. I don't know if you can see it in it is a very aromatic drug which we usually use for children in pediatric conditions. And also we have after taking head bath, we have a nature of applying or rubbing the powder in the bregma, or the region where it is very, you know that, right? Brahmarandra, where that is present. We usually rub there so that we can maintain the immunity level, so that we are not sustained to a lot of cold outside. We won't be more sensitive. We can maintain the weather outside when we do our daily routine. So kashayams, as we already said, that in North we use herbal kashayams in the home remedy. As a home remedy, we can use, like as I said, for fever, we can use kashayams made in home only. That is one which I said, this Coleus embolicus, that drug. I don't know what we say in Ayurveda actually, and I really forgot about it. But then other than that, we use tulsi, we use shunti. Shunti, you already know, adrak. That. And then just give a boil the water, boil it in water for some time, and then give it for drinking. It is really good for improving their digestive capacity, and also it gets rid of the fever if they have present, or any cold, cough, fever, anything.
Actually, it is Aam Pachak also, and you can take it daily for the Aam Pachak. Okay. Yes. So. So my next question is, any kashayam, ready-made kashayam which you can suggest to people to take daily, because in North India we don't get all the herbs as fresh as you get. So any kashayam, ready-made kashayam from any company, because in South India there are many companies making the kashayams, and in North India we only get Kotakal or Vaidyaratnam. So any kashayam which you can suggest to people they can take daily.
Yes, the present scenario, the COVID scenario, I think the best kashayam to take is to improve our Agni. So for that, usually I prescribe Indukantam kashayam, which is very good for improving the digestive capacity and Agni. And also Amritottaram kashayam, which is also available in market. That is for relieving the ama. Or if you have any kind of joint disorders or anything, you can go with Amritottaram in the starting, and then come back to Indukantam, and then again, like that. And also there are many kashayams in our Kerala, or I think all over India, according to the symptoms and the condition we usually use. So in inflammatory conditions, if I can say, in some swelling conditions, you can use Punarnavadi kashayam. That is also very, these three are my favorite kashayams, which I usually keep on adding to the patients in the starting stage.
Okay. Okay.
And there, of course, there are n number of kashayams, but these three are most of my favorite, which I feel that this is the best for them. Yes.
And the Amrutotram Kashayam contains 3 herbs only, right? That is Amrita and
Yes.
Shunthi, and third is I don't remember third one. And it contains 3 herbs.
Mainly it is for Amapachana
Yeah,
only.
yes,
So I
mainly
said
for
as
Ampachna. Exactly, exactly. And it is very good. It is good for fever also. Here we give it
yes.
for the fevers. Yes, so it is good.
Even Indukantam Ghritam is available, but
Yes,
usually in the starting stage of Ama, we don't introduce Grit.
yes, yes, yes.
We usually go for dry drugs and then come for
Yes,
Grita.
actually, why
As
I
a
am
Rasayana, we
yes, why I am coming to Grita is because in North India in winters there is so much of dry season. Also in Varsha Ritu, as we know, there is dry season. So what people take from these Ayurveda lectures from the YouTube, that if some doctor mentioned Kashayam, they go on taking Kashayam, but they don't know that if the season is not favorable, if the Ritu is not favorable, that can cause harm also. Grit is also important, right? So my next question is, what is the importance of food according to Ritu, according to season?
Yes. See, as we already know, we have Shad Ritus in our nature. So according to each Ritu, the food culture also should be changed, as mentioned in our Ayurvedic text. So now at present we have rainy season, right? There also rainy, here
Yes,
also
yes.
rainy. Yes. So in rainy season, usually we take the food which is not very heavy for us to digest.
Exactly.
Especially we have to see the Agni also. Nowadays, due to the COVID scenario also, people are having very less Agni in them, because and they are having a very bad food culture also,
Exactly.
due to the Western culture coming inside, that is having ready-made foods, not a homemade food, taking ready-made foods. But now, because of the COVID scenario and sitting at home, staying isolation, everything, we do prepare at home. But then again, we have to see that we have to add some digestive appetizers to make our food more easily digestible. Digestive appetizers are usually available in home, like what I said, jeera, ajamoda, and turmeric, and coriander. Coriander is very important. Coriander powder is also available. Coriander is also available. And then also the shunti, adrak, which is very important.
Yes.
And for gas-related people who have cardiac disorders, they can also go for lashun, that is garlic. Yes, yes. But again, there are many cares and to be taken when you use this in kitchen. And if you know the herbs properly, it is better. We use it better. Yes.
Exactly, exactly. If I go with the Charak Samhita or go for the Ashtang rhythm also, the chapter starts like that. First is dincharya, second is ritucharya. Because acharyas also want that we should maintain our health rather than become diseased and then go for treatment. So how important is to maintain health?
Yes, you said 100% correct. Before going to treat a disease, it's better to maintain our health. So for maintaining health, as told, we have to follow the dinacharya and ritucharya as told in our text. It is actually quite easy, not very difficult to follow. But then people are not aware of the knowledge what we have in our Ayurveda. That's what we have to promote and give it to them. So mainly in Ayurveda, we say how to maintain health is, in Ayurveda, there is a concept of immunity, that is ojas, that can be improved only by improving our Agni. As we know that for any kind of disease, for any kind of a problem, when a patient comes to us, first we ask them about their digestive problems, their emotions, to show the tongue. The tongue also represents many things in our body, and we also know that if you see just the tongue of the patient, we can understand how bad or how good is his digestive system. coming to the point, we have to know that we have to improve the Agni of a person for improving their immunity. That's the main thing. So again, Agni related. Agni is very important for us in Ayurveda, for Ayurvedic practitioners. So usually what I do is anyone, any medicine, for any problem they come, even for a pain or even for any other digestive issues, anything joint related, maybe it kind of ama or headache, anything, first go for the Agni, correct the Agni, and then do the later problems which can be solved. Then go for the problems which can be solved.
Exactly. If a person falls ill, because for example, if someone catches fever, so first symptom arises is that he lost his hunger. He's lost his hunger.
Yes.
So in Ayurveda also, it's mentioned that if a person is having fever, you should not go for the antipyretic. What is mentioned in Ayurveda? Don't go for lowering the fever. First, you have to maintain, see that Agni is very low, so you can't give anything which is heavy to digest. So that's correct. So these are the questions. So anything you want to add for today's lecture?
Yes, thing is that as you already mentioned about ritucharya and dincharya, I just want to suggest everyone that Ayurveda is the lifestyle which makes us healthy. So please follow it in a manner so that they can maintain their health and get rid of all the diseases. Maybe it might be corona also. See, corona is not very new to Ayurveda. In Ayurveda, we don't have a particular name for a particular kind of disease, but everything we have a solution. So here, usually in Kerala, the Kerala government has supported Ayurveda doctors, and we have started good campaign. I mean, not only campaign, Ayu tell you communication, so that people can, whoever is in need of maybe in the right scenario, COVID, um, positive cases or post-COVID or prevention of COVID, anyone can call in this Ayu helpline number. And then I have already spoken to more than 50 patients by now.
Okay.
It has started from, there are many doctors in this, but then it has started from the from 2020. Now it is already 2021. Now, because after in 2020, in half, we had a lot of calls. And then me personally had 50 calls, and many others, like maybe there are in each area or district, many doctors related to this. So it was a very good work for COVID, what we did here. And usually in Kerala, we say, especially in this ritucharya, as you said, in Varsha Ritu, that is rainy season, we not only see about the food, we also see about the atmosphere. Like, you know, if it will be floody and it will be very watery, you have to keep it dry, and you have to keep your body dry. Again and again, because always when we walk here and there, we have to maintain the cleanliness. And then the atmosphere, we usually do aparajita dhupa churnam.
Yes,
That
yes.
is, aparajita dhupa churnam is used for dhupana here in morning and even evening. So it gets rid of many of the viruses and the microorganisms in
This
the
this
atmosphere.
this is again one of the
Yes,
rituals in South India. I have
yes,
seen that.
yes, yes. So that is also a wonderful ritual, which we feel that yes, this is the best, because see, I personally, after my Ayurvedic what do you say, course, and after I have become an Ayurvedic practitioner, I personally have not used any I didn't have, I mean, for I don't know, I didn't want to use my for any of my problems an allopathic medicine. So that might be because there are a lot of medicines which are in Ayurveda, which we again need to know about it more in detail. But then Ayurveda has always made me safe, made me healthier, made me grow in my life. So I recommend everyone to use Ayurveda in their life, so
Okay.
that they can be healthy, safer, and they can improve their maximum capacity to, they can improve their productivity actually. If you're healthy, you can make others healthy. Just like if you're happy, you can make others happy.
Exactly. Exactly. So this is for today's, talks. So thank you, Dr. Dhanya, for your time. I know you are busy in the morning. Also, you have yoga sessions starting from I think after 3 days, right?
Yes, yes, yes.
Okay. Uh, so can you tell
Yeah,
tell
this
something about that? If someone want to join, how they can join it?
I can share you the poster. You can share it to your viewers.
Okay, okay, okay.
It is. I have just started in this COVID scenario because when I thought, why sitting simply at home, though you have the knowledge with you, so thought of just thinking about physical activities like yoga. Now that is absent in everyone's home. So for that, I just thought of a different kind of youth. So that I thought we can take an online yoga session.
Okay.
So that was actually, again, the Ayurveda Medical Association of Kerala had advised me to do this. It was a good initiative by them for me to start this yoga classes. And it was like, there were only 7 participants in the first starting session. But then it was very good. And I had shared the reviews of theirs
Yes, I have seen.
in my status. I think you saw that. Yeah, they liked it and they also wanted to continue. There were many, like there were village people, a government employee, a bank employee, everyone in this session, and it was good. So I thought, okay, why not continue it in the future so that it will be helpful for others.
Oh. Okay, thank you, ma'am. This is for today's health talks. So thank you for your time. Okay, namaste.
Thank you, Pranada Ayurveda and Dr. Sahil for
Uh,
inviting me. It was a good experience for me. Thank you.
okay, thank you.